Hi everyone, welcome back to our channel. Today we will discuss about the most expected medical surgical nursing MCQs. Let's start. First question. A patient is admitted with a chest pain radiating to the left arm, sweating and shortness of the breath. The priority nursing intervention is option A. Administering morphine, option B. Giving oxygen at 2 to 4 liter per minute, option C. Obtaining a 12 LED ECG, option D. Preparing for the thrombolytic therapy. The answer is option B. Giving oxygen 2 to 4 liter per minute, because in suspected MI patient we are using the priority of A, B, C. A for airway, B for breathing and then circulation, breathing and then C for circulation. So at first when the patient will come, we have to give the oxygen at 2 to 4 liter per minute. After that we are giving the breath then circulation. So the answer is option B. Next, which electrolyte imbalance is most dangerous and requires immediate intervention? Option A. Hyponatremia, option B. Hypokalemia, option C. Hyperkalemia, option D. Hypocalcemia. The answer is option C. Hyperkalemia, because high potassium causes life-threatening cardiac arrhythmias. Example like VT, then VA, ventricular tachycardia, ventricular fibrillation and asystole like that. ECG changes includes tall peaked T wave. It is the most urgent imbalance to the correct. Next, a patient on mechanical ventilation suddenly develops high peak airway pressure and absent breath sound on the right side. The most likely cause is option A. Pulmonary embolism, option B. Pneumothorax, option B. Mucus plug, option D. Atelectasis. The answer is option B. Pneumothorax, because in the ventilated patients, sudden high airway pressure plus absent the breath sounds on one side indicates the tension pneumothorax. It is in the emergency needing immediate decompression. So the answer is option B. Pneumothorax. Next, the Parkland formula for the fluid resuscitation in burn patient is option A. 2 ml into body weight into total body surface area, TBSA. Option B. 4 ml into body weight into percentage of TBSA. Option C. 3 ml into body weight into TBSA. Option D. 5 ml into body weight into TBSA. The answer is option B. Parkland formula 4 ml into body weight into TBSA, total body surface area. Half of the volume is given in the first 8 hours. Half of the volume is given first 8 hours and another half of the volume given in the 16 hours. Lactate ringers, ringer lactates or lactate ringer is the preferred fluid for the burn patient preferred fluids. So the answer is option B. Next, which condition presents with moon face, buffalo hump, central obesity and the purple streak? Option A. Addison disease, option B. Cushing syndrome. Option C, hypothyroidism. Option D, pheochromocytoma. The answer is option B, Cushing syndrome, because it is the classical features of the excess cortisol moon phase. When the cortisol will increase, then it saw the moon phase, buffalo hump, and the central obesity like osteoporosis, hypertension, and in the addition, this is the opposite, low cholesterol. So the answer is option B, Cushing syndrome. Next, the nurse is caring for a patient with COPD. The oxygen should be administered at option A, 2 to 3 liter per minute via nasal cannula. Option B, 5 to 6 liter per minute via simple mask. Option C, 10 to 15 liter per minute via non-rebreather mask. Option D, high flow 100% oxygen. The answer is option A. For the COPD patients, really or on the hypoxia drive to breathe, high flow oxygen can suppress the respiratory drive, leading to the CO2 retention. Safe level oxygen is 2 to 3 liter per minute, 2 to 3 liter per minute, and we use for the nasal cannula also we used. So the answer is option A. Next, which type of shock is characterized by the warm flushed skin initially? Option A, hypovolemic shock. Option B, septic shock. Option C, cardiogenic shock. Option D, neurogenic shock. The answer is option B, septic shock, because in septic shock, early phases show the vasodilation, warm flushed skin. Later, skin becomes cold, clammy, and hypovolemic, and cardiogenic shock, cold, clammy skin. So the answer is option B, septic shock. Next, a patient with cirrhosis has the ascites and confusion. The nurse suspects the hepatorenal syndrome. Option B, portal hypertension. Option C, hepatic encephalopathy. Option D, GI bleeding. The answer is option C, hepatic encephalopathy, because confusion plus cirrhosis, it's an hepatic encephalopathy due to the hepatic encephalopathy due to high ammonia level. Ammonia level is increased, and this treatment is lactulose and protein restriction. So the answer is option C. Next, which nursing action is essential during the blood transfusion? Administering through the 22 gauge IV cannula, monitoring for reaction within the first 15 minutes. Option C, using dextrose 5% solution to run with blood. Option D, warming blood before the administration. The answer is option B, monitoring for the reaction within the first 15 minutes. Administering through the 18 gauge cannula should be used. Use the normal saline, not the dextrose 5%. Warming blood before the administration, no. Next question. The earliest sign of increased intracranial pressure is option A, Cushing triad, hypertension, bradycardia, irregular breathing. Option B, headache. Option C, papilledema. Option D, change in the level of consciousness. The answer is option D, change in the level of consciousness, because the earliest and most sensitive sign increased the ICP. ICP is altered level of consciousness, ALOC. So the answer is option D. Next, which finding indicates the digoxin toxicity? Option A, bradycardia and yellow vision. Option B, tachycardia and hypotension. Option C, polyuria and dry mouth. Option D, tremors and the restlessness. The answer is option A, bradycardia and yellow vision. Because digoxin toxicity present with the bradycardia, nausea, vomiting, confusion and the visual disturbance like yellow and green halos. So the answer is option A. Sometimes it show the green also, green halos, yellow vision also green visions. So the answer is option A. Next, a patient with acute pancreatitis should be managed initially with option A, oral fluids, option B, IV fluids and NPO status, option C, low fat diet, option D, high protein diet. The answer is option B, IV fluids and NPO status. Acute pancreatitis requires NPO, rest the pancreas, and IV fluids, sometimes NG suctioning, pain relief, oral feeding is avoid. Totally avoid oral feeding. Avoid oral feeding. Oral feeding. So the answer is option B. Next, in hyperthyroidism, thyroid storm, the most critical nursing intervention is option A, cooling the patient, option B, administering propranolol, option C, providing high calorie diet, option D, giving thyroid hormone replacement. The answer is option B, administering propranolol. Because thyroid storm causes the severe tachycardia and hypertension. So beta blockers, propranolol controls the heart rate and reduce the mortality. So the answer is option B. Next, which lab result is most concerning in a patient with the diabetic ketoacidosis? Option A, blood glucose level is 320 mg per del. Option B, potassium is 2.8 mg per liter. And option C, bicarbonate 18 mg per liter. Option D, pH 7.30. The answer is option B, potassium 2.8 mg per liter. In diabetes ketoacidosis, in DKA and hypokalemia is a life-threatening and must be corrected before the insulin therapy. Insulin drives potassium into cells, worsening the hypokalemia. So the answer is option B. Next, a patient develops sudden chest pain and dyspnea after long surgery. The nurse suspects this is an option A, myocardial infection, option B, pulmonary embolism, option C, pneumothorax, option D, pneumonia. The answer is option B, pulmonary embolism. Because post-operatively immobility leads to DVT, deep vein thrombosis, and deep vein thrombosis leads to the PE, pulmonary embolism. Sudden chest pain, sometimes symptoms, sudden chest pain, dyspnea, tachycardia are the classical sign. So the answer is option B. Next, which IV fluid is used in the hypovolemic shock due to hemorrhage? Option A, 0.5% 45% NaCl, option B, 5% dextrose, option C, Ringer's lactate, option D, 10% dextrose. The answer is option C, Ringer's lactate. Next, because in a trauma hemorrhage, isotonic crystalloids like NS and RL are the first choice replacement. Dextrose are not used. Next, the classical ECG finding in hypokalemia is option A, peaked T wave, option B, prolonged PR interval, option C, U wave, option D, ST elevation. In the hypokalemia, flat T wave ST depression, flat T wave should be not peak, it should be flat, and ST depression, ST should be depression, HC should be depression, and U wave should be seen, and prominent U wave will be seen. So the answer is option C, U wave. Next, which nursing intervention is essential in the patient with increased ICP? Option A, keep head flat. Option B, maintain neck in the flexed position. Option C, elevated head of the bed 30 degree. Option D, perform frequent suctioning. The answer is option C, elevated head of the bed 30 degree. Because head of the bed HOB 30 degree promotes the venous returns, drainage, and reduce the ICP. And flexion and flat position increase the ICP. Suctioning can worsen the ICP. So suctioning is contraindicated in the ICP. Next, in shock, the most important first step in the management is option A, maintain the airway, option B, administer vasopressor, option C, give IV antibiotics, option D, insert urinary catheter. In the shock, at first we have to see the patient condition. If patient is in the safe place, then we give the maintenance airway. If the patient is not safe place, we have to hold the patient. We have to prevent the patient from the injury. This is the first priority, but in the option there is not there, so we will go for the maintain the airway. Next, the nurse is caring for a patient with suspected appendicitis. Which intervention is contraindication? Option A, keeping the patient NPO, applying ice pack on the abdomen. Option C, giving opioid analgesics. Option D, apply heat pad. Heat increase. Option D is the correct answer because heat increases the blood flow. Risk of the rupture of the appendix. Ice pack reduce the pain and inflammation, so it can be used. NPO should be there because if the surgery is there before the 4 to 8 hours, keeping the patient NPO and giving opioid analgesics also correct. So the answer is option D is contraindicated. Thank you everyone. If the content is helpful for you, please like our video, comment and subscribe our channel. Thank you everyone.